At the C4 vertebra, the common carotid branches into the external carotid and the internal carotid artery. At the internal carotid artery, the first branch that comes off is the central retinal vein, which is down underneath here, and it penetrates into the optic nerve and follows that all the way into the globe. Next branch is the ophthalmic artery, which is the primary artery for the outside vessels, and it travels up here to the lacrimal artery first, which travels along the lateral rectus and then supplies the lacrimal sac and goes further than that to the eyelids. Next we have the short posterior ciliary arteries and the long posterior ciliary arteries, and the short go into the around the optic nerve and form the circle of Zen, and the long posterior ciliaries penetrate the sclera and continue on up to the front of the equator of the globe. From there we travel on along here, and we have the posterior ethmoidal artery and the anterior ethmoidal artery, which go into the ethmoid sinus here. Continuing farther along up than that, we have the supraorbital artery, the medial palpebral artery here, the dorsonasal artery, and the supratrochlear artery. And we also have the anterior ciliary arteries here. Those are extension of the arteries that travel along each rectus muscle. Off the muscle, then they penetrate into the front of the globe. You have the vortex veins on here, and the superior and inferior ophthalmic veins, which combine in the back here to form a common vein. We also have the external carotid artery and the superficial temporal artery. And we've shown here the maxillary artery, which turns into the infraorbital artery here. And we've shown the middle meningeal artery, which synastomizes here, forming the recurrent meningeal artery. And in about 1% of the total population, that's the primary blood flow of the eye instead of the ophthalmic artery.